For Dorothy. I said to Dorothy that she is automatically in the Hall of Fame because both my sister and late mother are named Dorothy. So, happy Valentine's Day, everybody. A lot of red in the room. Thank you, Dorothy Jean-Baptiste, for that introduction and for sharing your story. And your story, as I'm sure Troy and John and the rest of the folks here will attest, is the reason why we're here today. So bless you and thank you. And you're in our prayers, and you are probably more importantly, or as importantly, you're in our actions. I got to give a huge thank you and shout out to the entire team here at the Willingboro Senior Citizen Center. This is not hardly my first, third, fifth, or seventh trip here, for hosting us so graciously, and especially to my dear friend and the executive director of the Township Department on Aging, that woman right there, Reva Foster. Reva Las Vegas. I'm incredibly honored to be joined by partners in governing, including to my left, the Banking and Insurance Commissioner, Marlene Caride. Marlene, great to have you. Acting Commissioner of the Department of Human Services, Sarah Edelman. Sarah, great to have you. Two incredible leaders in our Assembly, and we'll hear from each of them, Senator Troy Singleton and Assemblyman John McKeon. And we'll also hear from the head of the Office of Healthcare Accountability and Transparency. What happened to Shabnam? She's right in front of me, Shabnam Salih, rather. By the way, you heard the pool balls. If time permits, Reva, we may want to get a game of 8-ball in before we leave here at the end of this. I know I don't see him and I don't see her, but I want to give a shout out to both Senator Joe Vitale and Senator Nellie Poe, who have been extremely involved in a lot of what we're talking about today, as well as Assembly Health Committee Chair Dr. Herb Conaway and Assemblywoman Carol Murphy. I want to give Dan O'Connell, another dear friend, County Commissioner Director, a shout out, Mayor Kaya McIntosh, and to outstanding council members. Mayor, great to be with you and your colleagues. And I want to give one more shout out, and that is to a Willingboro native, Louise Rush. Louise is the Director of Aging Services at the Department of Human Services. She oversees, importantly for you seniors, PAD, P-A-A-D, which is a big, important program. As I said, she's a Willingboro native. She's obviously wearing red for Valentine's Day, but even more importantly, it's her birthday. Happy birthday, Louise. I'll spare you the singing. Maybe we'll hit that later. So last month in my State of the State address, I recommitted our administration in this new term to a focus on improving affordability for New Jersey's families and seniors. And I specifically cited making health care more affordable. We've made strong strides over the past 4 years to put health care back within reach of many. Our state health care marketplace, under Marlene's leadership, is providing insurance to hundreds of thousands of residents, many of whom had never been able to afford high-quality health insurance before. This past December, we initiated a long-range program alongside numerous stakeholders to examine more closely what drives costs higher so that we could take real action to push them back down. And as we undertake this, health insurers and health care providers have committed to limiting cost growth across the next 5 years. Shabnam is overseeing that, and I want to thank her for that. And through the budget, and again, thanks to our legislative partners, we have increased our support for the popular, as aforementioned, Louise, PAD and Senior Gold prescription drug programs. Importantly, at the start of this year, we expanded eligibility for these programs, adding 20,000 more seniors. Behind each of these efforts has been the Office of Healthcare Accountability and Transparency that we created 2 years ago, and again, which Shabnam leads. Her focus, and the focus of the office, has been to promote a whole-of-government approach to healthcare affordability and to dig deep to find new ways to save consumers money on healthcare. Multiple departments and agencies have been brought together under this effort, and I also want to give a huge shout-out to the Acting Director of the Division of Consumer Affairs, Sean Neefsey, who has been a big part of this. Perhaps nothing is as important to this as reining in the costs of prescription drugs. A 2020 poll reported that 1 in 5 New Jersey residents either did not fill a prescription or did not take their drugs as prescribed due purely to concerns about costs. And by the way, it goes from 1 in 5 to 1 in 4 if you look at just seniors. It's a shocking statistic. And these issues are not just limited only to specialty drugs. This problem is even more acute for the drugs that residents need daily to control chronic conditions like insulin, as well as the EpiPens and asthma inhalers that Dorothy spoke to that others need to survive an emergency. Let this one sink in. Across the country, 1 in 4 diabetics say they ration their insulin because they can't afford to keep a full supply on hand. So today, I am proud to be here with my partners in the administration and legislature to highlight a package of 4 bills that we are working on together and putting forward to address this problem. We are putting affordability and price transparency across the entire prescription drug supply chain under the spotlight. Here's our plan. 1, we will cap the out-of-pocket costs to consumers where we can for certain emergency drugs, and specifically for insulin, asthma inhalers, and EpiPens. Under this proposal, anyone covered by a state-regulated health plan or the state health benefits or school employee health benefits plans will be able to get a 30-day supply of insulin for $35 or less, purchase EpiPens for $25 or less, and get asthma inhalers for $50 or less. Secondly, we will initiate a new and higher level of oversight over pharmacy benefit managers, known by many as PBMs, the third-party companies who manage many prescription drug plans, and we will prohibit some of the bad practices that drive costs up. 3, we will create a new system to collect, analyze, and report on the entire process of drug pricing across the entire supply chain, from manufacturers to distributors, to those pharmacy benefit managers and insurance carriers. Shabnam, I think you'd agree a couple of states that have gone ahead and done this, they have seen not just the transparency become a reality, but also real progress on costs. And 4th, we will allow the Department of Human Services, NJ Family Care Program, to join a multi-state purchasing pool to negotiate more competitive drug prices, saving our program and taxpayers money. With these efforts, we will join the growing number of states that are saying enough is enough when it comes to rising drug costs by taking a long look under the hood of the entire process and then fixing what needs to be fixed. These are the smart steps we can take now for both short-term and long-term affordability and accountability. With that, it is now my pleasure to hand the podium over to Willingboro's own and outstanding leader in our state Senate, Troy Singleton. Love the sweater.
Good afternoon, ladies and gentlemen. As the governor said, I am home, and it's always good to be home in the community that helped raise me, helped my maturation as a legislator and as a man in Willingboro Township. I'm excited to be at the Reva Foster Senior Center, dedicated by the great leaders here in Willingboro to an outstanding public servant. The governor talked about a great deal about the package that we're doing. The underlying current of that package is this idea that it is no secret that New Jersey has an affordability problem. Now more than ever, policymakers have to listen to those who feel that the pleas of economic concern are falling on deaf ears. We need to enact policies that reflect that our state has grown somewhat more unaffordable. And we sadly understand that this crisis affects all of us. Nowhere where it's more pronounced than in the delivery of prescription medicine. My office, which is one town away from here, I grew up in Buckingham Park, which is just across the creek behind us. And I will share with you this story that happens every time I come home to Willingboro. Someone grabs me. No one calls me senator in town. They call me Troy. And those who know me a long time call me T-Roy. And will say, Troy, my mother is cutting her pills in half. Or my father is skipping his prescription medicine. When I come to this building, my friend Reva Foster pulls me aside and brings me over to talk to somebody. It's those stories that happen each and every conversation. And in the richest nation in the world, and one of the richest states in that nation, we should never have this Hobson's choice of choosing between our medicine and our food or our rent or any of our expenses. No one should go to the poorhouse because they got sick. And it's our obligation as policymakers to do something about it. The governor outlined a package of bills that we're going to be moving forward, bills that were introduced today in the state Senate, I imagine introduced in the Assembly as well, under the great leadership of our next speaker, who you will hear from, my dear friend John McKeon. The governor introduced our Commissioner of Banking and Insurance, a woman I was proud to serve with, Marlene Caride, in the legislature. And she knows these stories because we used to hear them and talk about it all the time as legislators. But time for talk is long since past. It's time for concrete action, for us to do the things that are necessary to make sure that no one makes those choices, that no one are forced to have to make those choices each and every day. This package of bills, I'm proud to have my name associated with them. But rest assured, there will still be more work that needs to be done. There will be more efforts that will need to be undertaken. Things like ensuring that savings from carriers are delivered back to the consumer so they have it, not going through a funnel where the consumer doesn't see it at point of sale or in their premium reduction. And making sure that we have the authenticity of boards like a prescription drug affordability board that can put downward pressure on pricing. These bills are incredible that we're doing, but the work will continue once we get those passed. The work will continue. And with your collective help, your collective effort, we can finally put the downward pressure on prescription drug pricing that we all need and desire for those that we care about, those that we love, and like myself, those that needed to stay alive. So I thank the governor for coming to my hometown to pronounce this and put such an emphatic imprint on it. The last time he did one of these press conferences where we were together was when he stood by my shoulder and said, Troy, we're going to get environmental justice done. And we did. We set a standard that other states are trying to emulate. Let's use this opportunity to set another standard that other states will emulate. Because they'll say New Jersey, once again, is a thought leader in moving public policy forward that addresses the ultimate challenges of our day. That's the leadership that the governor embodies. That is the leadership that will take all of us to get this done. I'm proud to stand with him. I'm proud to stand with my friend, Assemblyman John McKeon, who's been fighting this fight a long, long time and has been a great advocate. And the governor talked about my two colleagues in the Senate who could not be with us today. No finer champions and fighters than Senator Joe Vitale, our Health Committee Chair, and Senator Nellie Poe, who leads our Commerce Committee, where these bills are referenced to right now. We look forward to the work ahead, and we look forward to getting this done. Thank you.
Thank you, Troy. It's an honor to be here with you, as always. And you're absolutely right. It was you and McKeon and I who stood together on environmental justice. And neither one of these fights are, as you rightfully point out, are short. And there's not a moment where you can say, finally, we're there, we can pat ourselves on the back. This is all a work in progress, whether it's the environment and environmental justice in particular, or healthcare costs. Thank you for your leadership. Thanks for hosting us so graciously today. With that, please help me welcome the aforementioned, another great champion, in this case on the Assembly side of the House, dear friend and great leader, John McKeon.
Governor just said he loved my socks. Those are my cool-ass grandpa socks, in case anybody's... Yeah. They're all teasing me about the shoes, Governor. They're calling me Mini-Me because I've got the, Troy and I. We've got the Allbirds on. Thank you all very much, and happy Valentine's Day to all as well. Governor, you, as always, are humble and reference it just for a moment, but just 4 years ago, with you having made health care a priority, the Affordable Care Act was under attack. With your leadership, we made certain imbued in state law were things like having protection as to lifelong caps, as to pre-existing conditions, regarding keeping our young adults on our policies. And with that, you engaged in a reinsurance program that instead of a 12% increase in the individual market, it was a 6% decrease, and that set the stage for Commissioner Caridi, who, not that I'm counting, but there's now 307,000 lives as of January that are in the exchange that are all because of the efforts that you collectively made. So congratulations as it relates to that. Now, I am thrilled to be in the hometown of Senator T. Roy. And, you know, you had to be careful before because, you know, before he was a legend down in Trenton, he was a legend on the football fields here, and he kind of looked at me the wrong way. The Super Bowl just played. I thought he was going to take me down. But Troy, it truly is, you know, an honor, and as much as I look really young, I know, except for I'm old. And I remember Troy going back to when he was a part of the staff 20 years ago in the state legislature and was a driving force in all the good things that were able to occur and has just continued to do so. And I'm, you know, feel so proud to be watching your continued maturation, and that legend really does continue to grow, Troy. The only thing I'm going to say is that we've had a couple great bills together, and this will be a number in addition. So it's kind of like a Batman and Robin thing. I'm older. I get to be Batman. That's all I'm saying. It'll be a pleasure to work with you. You know, the heart-wrenching stories, and Dorothy, you were so kind in sharing what you did, but, you know, there's so many that we all know of, and Troy just spoke to neighbors and people we know. I know of a 37-year-old who was diagnosed with multiple sclerosis. She'd say, I didn't cry when I got the diagnosis at all. I cried when I found out about the financial toxicity that went along with it. I know a 34-year-old, and we talk about insulin, that's insulin dependent and was taking vials of the insulin and putting them in her refrigerator until there were enough that she could then take a syringe so she could make another one. That just can't happen, you know, in a country like ours, in a state like ours. You know, a CEO of a startup biotech company about 25 years ago now had the first drug developed that was $100,000, meaning for the year. And everyone said, how could you do that? And his answer was, because I can. And when it comes to it, you know, we are the only country in the world that has no role in setting prices for prescriptions. I mean, that's unacceptable. Avastin, which is a cancer drug, costs 10 times more here in the United States where it was developed than it does in Great Britain. Haravani, and I'm probably butchering that pronunciation, but if you have Hep C, you know of it. It costs $10,000 more in our country than it does elsewhere. So it's clear when you just put pure capitalism and this Byzantine system as to how it gets delivered to the market, it results in the highest drug prices in the world. Now, capitalism is good if you're dealing with maybe a luxury car, and who can afford it can afford it. But I think we're all who are here today agree that health care is a basic human right for every American and everyone in the state of New Jersey, and which is why government needs to step in, and step in we will. I really won't bore you all in this, you know, spider web that is the way that our drugs come to market, but it's just it's set up in a way that is just destined to do, frankly, what it has. You know, the PBMs, they put together what's known as a formulary. And that's when they kind of rank these drugs that fit into 3 separate tiers. Let's just say tier 1 is $5 copay, $10 tier 2, and just co-insurance for tier 3. Now, that formulary is supposed to be put together, you know, in a way by independent clinicians and scientists, but there's discretion. The same way there might be discretion in choosing a car. That's sometimes BMW versus Lexus, whatever you want to think. You know, Chevrolet versus Buick, I don't know. But this discretion then enables them to go back to the drug manufacturers and say, how would you like to be in tier 1? Well, discount a little bit more. But then here's the problem. Like with a luxury car where there's a sticker price. Forget about supply chain recently, but nobody pays sticker price on a car, right? Well, in pharmacy, they call them, and I love this acronym, wholesale acquisition cost. That's basically a sticker price. The acronym is WAC. The only people get whacked are the consumer. And it just makes sense. If you're from pharma, you're going to say, I'm going to set the highest whack I can because I know I'm going to have to negotiate off of it. And guess what? The managers are saying, I get paid in the percentage that I'm able to negotiate down, meaning the PBM, so I don't care if those list prices go up. And that's why we've seen prices triple over a short period of time, and why they're so less expensive in other nations. So we're going to do something about that. As you know, as the governor indicated, we're going to do something about those 3 medications that affect so many of us. Geez, 700,000 people alone in our state are insulin dependent, if you can imagine, let alone the inhalers and the EpiPens. But significantly, we're going to look into the PBMs. We're going to pull back that curtain, and we're going to know. There's going to be data reporting as it relates to every segment of the market. There's going to be analysis. They're going to have to be licensed, Marlene. And those discounts are no longer going to go to profits. They're going to go where they should, back to the consumer, back to us, because it's otherwise unsustainable. Governor, you again referenced, I can't imagine. You know, I get a prescription and let me just get something over the counter that I can afford. Or I'm just not going to fill it. Or I'm going to cut my pills in half. 25% of the people on prescriptions, that's what they're up to if they're seniors. That is wrong. I'm going to leave you with just noting Dr. Fred Banting. If you know who that is, you're worse of a nerd than I am. 1923, Dr. Banting invented insulin. And he decided that it would be against his oath as a doctor to go ahead and patent it. He wanted it to be available to everyone. He actually ceded it to 2 students of his who weren't doctors yet, and they followed that ethical path and ended up selling it for $1 to the University of Toronto. They were Canadians. So let's consider the innovation of Dr. Banting. And again, there's nothing wrong with capitalism. We should celebrate pharma for all the great things that they do. But we need to, again, get things back in balance. So, Governor, with your leadership, Troy, with your partnership, and with all of you, we look forward to getting this through the legislative process. I referenced Dr. Conaway and my colleagues in the Assembly to let's get it to the finish line. God bless everybody.
I'm not sure I agree on the Batman-Robin configuration, but otherwise, representing my client, Senator Singleton, Commissioner Gordon, really compelling stuff, right? Really, really compelling. And John, we would not be here without you. We're going to hear from a couple of other really important speakers and leaders before we call it a wrap, but the legislative leadership here is extraordinary in both the Senate and the Assembly. Thank you both. Next up, she's been referenced by a number of us. Please help me welcome a woman who's done probably more to get more access and affordability and health as it relates to health care in our state, probably in our history, the Commissioner of the Department of Banking and Insurance, Commissioner Marlene Caride.
Good afternoon, everyone. Governor, thank you so much for those kind words. And to my colleagues, Senator Troy Singleton, and of course, John McKeon, who I was in the House with for many years. It's great to see you guys in person again. Today's announcement continues to demonstrate our governor's commitment to making health care more equitable, affordable for our residents here in the state. Under his leadership, we have worked to improve access to health care for all New Jerseyans, and as a result, we have seen high plan selections through Get Covered New Jersey. Many of those who have enrolled are paying less than $10 a month for quality coverage that covers everything from preventive care to emergency care to prescriptions. But we know that even with that progress, we have more work to do to address healthcare costs for our residents. Due to high healthcare costs, too many residents are forgoing needed care and medication, thereby jeopardizing their health and creating long-term consequences. And we heard several of the stories from my colleague, former colleague, John McKeon, and as well from Senator Troy Singleton, of their constituents who have taken to splitting up their medication in order to make it last. Residents should not have to choose between filling a prescription critical to their health or buying groceries to feed their families. The proposals we're discussing today aim to alleviate the struggle of affordable or affording prescriptive drugs for our consumers. Limiting the cost of vital medication that treat life-threatening conditions at the pharmacy and creating certainty about the cost of that prescription when the resident needs it is a critical first step to helping our residents with chronic illness. We also know that many of the factors that influence the price we pay for our medications, and we need to increase our transparency around those factors, which will help us get to the root of what is actually causing those increases to our drugs and highlight the actions that are needed to be taken. The state needs enhanced reporting from drug manufacturers and distributors to provide greater contents on decisions around cost increases, price setting, and negotiation, as the Assemblyman had mentioned. With a robust examination of prescription drug practices and pricing, we can then take meaningful steps to reduce patient costs. We have made great progress in making health coverage more affordable and accessible here in New Jersey. Working together, we can build on that foundation and lower the cost of vital prescriptions for our consumers. I look forward to working with everyone who is here today to continue to increase healthcare affordability so that we could build a healthier New Jersey. Governor, thank you for having me here this afternoon.
Thank you, Marlene, for everything. Get Covered NJ is one of the most successful programs we've probably initiated in our time in office, and you've led the charge. So thank you for that and for your leadership on today. Last but not least, I mentioned Shabnam Salih, who is the director of our Healthcare Affordability and Transparency Office. It doesn't necessarily roll off the tongue, but it does extraordinarily important work. And I think several of us have alluded to this. Inevitably, and John, I know you'd agree, more transparency inevitably means better results for consumers, especially seniors. The more we know, the more we can zero in on what's driving cost increases. Shabnam and I were together in Trenton, I guess now a couple of months ago, announcing the program I mentioned in my remarks, which is we've gotten a lot of the stakeholders at the table to commit to a much more sensible pricing reality going forward. And I was using the example, you sit down at the kitchen table and you try to predict what next year is going to look like. You know, what's the price? Of course, these days the price of gas is exploding thanks to global issues. But you try to figure out milk, bread, gas, school books, rent, whatever it might be. And again, we've got some craziness going on now, but for the most part, you know, a family discussion at that table's got a pretty good handle on what that future looks like. The huge exception is healthcare. That's the one that if you look over the past 20, 30 years, if every other price has gone up like this, it's been one of these things, and we cannot take that anymore. We can't take it for insulin or asthma inhalers or EpiPens specifically today, but also more broadly. And the more transparency we can apply to this, the better the result for the folks who need this stuff the most. So with that, long introduction, Shabnam Salih, come on down.
Thank you, Governor, and good afternoon, everyone. Thank you, Governor, for your commitment on this issue, and Senator Singleton, who is here with us, and Assemblyman McKeon, for your partnership on this work and your tireless efforts to really draw attention to prescription drug cost issues in the legislature. Always appreciate working with you. Commissioner Caride of the Department of Banking Insurance, and Acting Commissioner Sarah Edelman of the Department of Human Services, and Acting Director Sean Nisi, who are here with us today of the Division of Consumer Affairs, for all of your leadership and resolve on behalf of New Jerseyans across the state. And thank you to our generous hosts for having us here today, and for the residents who are really at the heart of this issue for joining us this afternoon. You've heard from a lot of folks here today, so I will do my best to keep my comments brief. And most of, if not all of us here today are crystal clear about why affordability of prescription medications, whether they're critical life-saving or everyday maintenance medications a lot of us take, are so important. We have and will talk and will continue to talk, not just today, a lot about the high cost of healthcare and prescription drugs, but the main cost, a lot of us know, is way too high right now, is the human cost, whether it's a human life in immediate danger because of lack of access or long-term danger, or just the unbelievable stress too many residents face about how they will be able to afford the cost of their medication. Even more, all of us know, I bet that a lot of us know someone on insulin, and maybe someone who has struggled to afford it. Sometimes it's the resourceful staff in a physician's office that keep patients alive with insulin samples until the patient can afford their next dose. I know that person, or one of those people, and maybe you do too. We know that healthcare costs have historically risen faster than inflation and workers' wages in the state, and the governor just referenced that. Costs across the healthcare system, whether that's physician and provider costs, insurance premiums, or pharmaceutical drug costs, are simply unaffordable for too many residents. And rising drug costs continue to account for a significant portion of the unsustainable rate of healthcare cost growth. Over the governor's first term, and much of it in close partnership or in close collaboration with our legislative partners here today, we have made significant strides to improve affordability and accessibility for New Jersey residents. But we recognize that there's still a lot more to be done. Last year, the governor signed Executive Order 217, which directed my office with many of my colleagues here today across the administration to study, identify, and develop opportunities to advance affordability across programs, across markets, and the healthcare system. So today's announcement is a culmination of some of that work and complements our broader work the governor again referenced earlier, our work to mitigate the unsustainable rate of healthcare cost growth. So this bill package, when implemented, will have a critical impact in the near term for those who will benefit from some of the out-of-pocket caps you heard about today, while also putting in place critical oversight and regulation of pharmacy benefit managers. And I know the piece that I also, as a bit of a dork, get really excited about, but setting up a comprehensive data and reporting infrastructure and program in place to really help us build a better understanding of the cost drivers behind these high prices. So this is about how do we get under the hood to really understand what's happening so that we can then take more informed action in the future. I look forward to continue to working with the Assemblyman and our legislative partners to see this package become law and continuing to work with my colleagues across the administration and many of you in the room today to make high quality healthcare affordable for all of our residents. And thank you again to our generous hosts for having us here today. And everyone else here, look forward to continuing to work with you on these issues.
Thank you, Shabnam. Outstanding leadership. So, as they say in Hollywood, that's a wrap. We talked about 4 different initiatives today, and again, I want to thank John and Troy and their colleagues for the huge help. Number 1, specific action, Dorothy, against insulin prices, asthma inhalers, EpiPens. That's 1. Secondly, dig in really on the pharmacy benefit managers, the PBMs. Figure out what is going on under that hood. Thirdly, get to the whole, open the hood up on the entire supply chain of how the prescription pricing gets built up and paid by consumers, and with a particular focus on seniors. Again, there are a lot of different players in that list, but getting transparency, and as we've already said, inevitably transparency leads to a better deal for the consumer. And then fourthly, which is the one we've spoken least about, and I think is, John, at the earliest stages of formation, is the ability for Sarah and her colleagues to team up with other states to do bulk purchases of pharmaceuticals so that we can, just the law of supply and demand, get a better deal for our residents, again, especially our seniors. I want to thank Team Willingboro, especially my dear friend Reva Foster. Reva, you way in the back there? Reva's not playing pool, but she's in the back. Bless you and thank you. Troy Singleton and John McKeon, cannot thank you guys enough. Marlene, Shabnam, Sarah, Sean, thank you. Dan, thanks for hosting us. Mayor, thank you and your colleagues. Last time I was here, Tiffany was letting it rock. So it's good to be back. Dorothy, bless you. You're not just in our prayers, you're in our actions. And Louise, last but not least, happy birthday. God bless you all. Happy Valentine's Day, everybody. You can't do this to me. I cannot read that. These have to be much bigger letters because I'd like to do this without my glasses. I can't.